Hi. We're still having some people log on, but we're going to go ahead and get started this morning. So, good morning. My name is Tim Haran. I'm a licensed mental health child adolescent therapist with CHI Health. As we're all preparing for students to return to school this year, we recognize that the classroom may look much different due to COVID 19. Today, we'll be hearing from some local experts with CHI, some in person and some on video, and we'll be focusing on the science of COVID 19, anxiety heading back to class, trauma in kids, teacher wellness, and how to support student and family wellness. This webinar is not about policy. That information will be directed by your school and your school district. This is about how to navigate transitioning students back to class safely and with hope. So throughout this morning, we'll be answering some of your questions live. Some of the questions that were submitted in person when you registered and some in real time today. So feel free to start asking your questions in the chat bar on the side. So let's go ahead and get started. We all are experiencing fears regarding COVID-19 and returning to school. Those fears can also be related to mental health concerns such as depression and anxiety. One way to reduce those fears is by understanding the facts. Our first expert is Dr. V. Dr. V is a physician with CHI Health, Infectious Disease Control and Prevention. Dr. V will be providing information about health and safety. Afterwards, we'll be answering questions live with Dr. Quimby, who's also a physician with CHI Health, Infectious Disease Control and Prevention.
Hey, I'm Dr. V. I'm one of the infectious disease physician at CHI Health Creighton. I know we have been hearing a lot of things about COVID, and I wanted to kind of clarify and give some more information for all of you. When it comes to COVID, I think about it's not I anymore, it's we. How do we keep each other protected and help each other be safe? A little bit more about what is coronavirus, what is COVID-19. It's a virus that is most likely came in from an animal to humans, and now we have this infection. Coronavirus has 4 different strains, and we usually see them in wintertime as part of common cold. But what is new about COVID-19 is it's a novel coronavirus. So it's new. So you and I did not have ever exposure to this, and we don't have any antibodies to this. So that's why it's so novel, and we need to protect each other until we are able to have vaccine or antiviral medications. So how do we keep each other protected from coronavirus? It's really important to do masking, social distancing 6 feet apart from each other, and hand hygiene. So when you're running outside, you don't need a mask if you don't have anybody around you. If you're going to your car, if there's nobody around you, you don't need a mask. But you do need a mask, let's say you go into the grocery store and there's others around you, then you definitely need a mask. If you're going to the mall, you should wear a mask. Anywhere there's large gathering, there's others around you, it's really important to wear a mask. You're protecting the other person and they're protecting you. For COVID-19 infection, there's some people are symptomatic. So they know they're sick. They're coughing, they have sore throat, shortness of breath. So that's easy for them to know that they should stay at home and get better. But there are people who are asymptomatic or pre-symptomatic. Asymptomatic is you have the infection, but you have no symptoms, so you're unaware. And asymptomatic patients can transmit the infection to others, even though they are unaware they have the infection. Pre-symptomatic is that you start developing the infection and you're still spreading the infection, but you're unaware yet. You haven't developed any symptoms. So it's really important because of that. We all need to be wearing masks in large gatherings and around each other. So in classroom, that means it's going to be really important, depending on your district's policy, to follow that and, to wear a mask, hand hygiene, and social distance 6 feet apart if possible. When it comes to children, there have been cases are very low. There have been kids who have gotten severe infection, but those are related to when kids have had comorbidities, health issues. So kids are lower risk for getting the infection. However, the adults, like the teachers and staff, are at a higher risk. But how can our teachers and staff members protect themselves? It's going to be wearing a mask and doing good hand hygiene and being able to social distance whenever possible. I would like to describe a case where there were two salon employees that were symptomatic. They had masks on and they saw over 140 customers, and all customers had their mask on, and none of the customers acquired COVID-19 infection. So this shows the importance of masking. So let me show you how to put on a mask properly. First, you do hand hygiene. After doing hand hygiene, you pick up the mask, you put it around your face, around your ears, the ear loop, and you press around your nose if there is a metal component, and you seal the mask this way. And when you want to take off your mask, ideally you should do hand hygiene, touch around your ear loops, and remove the mask. The goal is going to be to keep your hands off your face. I know it's really tempting to touch our face, but it's going to be really important to keep our hands from our face and eyes, especially. When we touch things, you can get the COVID-19 virus on your hands, and if you touch your face, then you're contaminating yourself. So it's really important to do hand hygiene and avoid touching your face. There's been a lot of discussions about kids wearing masks. As an infectious disease physician and a mom of 2 kids, I think masks are okay on kids. The concerns are, will kids retain carbon dioxide? Will they get enough oxygen? And over and over, studies show that is not of any concern. They are getting enough oxygen. And also, this will not affect their learning ability. Kids are able to learn with a mask on, cloth mask or other type of mask. I get that COVID-19 is scary. As an infectious disease physician and mom of 2 children, I understand. But we have 3 simple tools that we could use to keep each other safe and our children. And I think it's going to be really important for us to reinforce washing our hands, social distancing, keeping 6 feet away, and wearing masks whenever possible. And when we're ill, to stay at home and not to come to work. Recovery at home with COVID-19 infection mostly includes lots of fluids, making sure you eat your meals, resting, and when you have fevers, taking anti-fever medication such as Tylenol or ibuprofen. How does COVID-19 spread? It's through droplets. So when somebody is symptomatic or asymptomatically spreading, it's usually most of the time droplets. The droplets are coming from our mouth or coming from our nose. That is why it's really important to wear a mask where we could cover our nose and mouth so we protect each other and we contain those droplets.
All right. So we're back live now with Dr. Quimby. Dr. Quimby is an infectious disease expert with CHI Health Creighton. So welcome, Dr. Quimby. Thank you for being here with us today.
Hey, thanks for having me.
All right, so we've got a lot of questions coming in and some that were submitted earlier. So let's go ahead and get started. First question, what are we seeing in our hospitals and in this region? Number of cases, severity, etc.
Our CHI network is 12, 14 hospitals in the area. And at any given time recently, we're at a few dozen inpatients with COVID-19. You hear about thousands of people infected or multiple hundreds per day, but most of them are not sick enough to be inside the hospital.
Okay. All right. Next question. What's the importance of mask wearing and when is it absolutely necessary?
Dr. V was mentioning that in her video just now. The importance is to help prevent spread of infection. And a good guideline as a time to wear a mask is if you're indoors and not entirely by yourself. I'm indoors, I'm not entirely by myself, but I don't have a mask on now. That's so the microphone can pick up better and there is nobody within 6 or 8 feet of me, although you can't see that.
But I can see over here. All right, that's helpful, that's helpful. Next question. Spacing of student desks in the classroom, managing movement in the classroom. Do we keep the doors open or closed? How could you speak to some of those, or what can you speak to some of those questions regarding the classroom management of spacing?
It's been a while since I was in school, although my kids go there now. There is no way you're going to have the all desks 6 feet apart and have more than a handful of kids in each room. So based on your environment, you can spread them out the best possible, which is why masking is important for people who can't distance. Door open or closed is probably not going to make much difference overall. The ideal thing for a classroom is to have what spacing you can. So 2 people sitting right next to each other at one table is not as optimal as separate desks.
All right. All right, next question. How often are we supposed to wash our hands and opposed to using hand sanitizer? Will we be able to eat in teachers' lounges and use commercial appliances in the lounge, such as an ice maker, coffee maker, toaster, etc.?
Overall, there's not a large amount of difference between washing your hands and hand sanitizer. Depending what hand sanitizer you're using and the additives in there, sometimes you can get like that lotiony gunk up feeling that a good hand wash can take care of. For teachers' lounges and that kind of environment, I can tell you that most of the breakdowns that have occurred in hospital and clinic settings were not in patient care areas. It was in break rooms and lunch rooms, because people are pretty good at wearing their mask while they're doing their actual job and out and dealing with patients, but then they go to eat their lunch and they're sitting right next to their coworker who might not be having symptoms, but tomorrow will have a scratchy throat. So ideally, if you are in an environment where you're eating or drinking, you want to distance from people if you can.
Okay, great. All right, next question. Is it safe to open schools?
You will get many answers to that question depending on who you ask.
True.
We don't have information in this country yet, so we can look overseas. Israel opened up schools without any sort of real precautions and opened up a lot of community activities at the same time and had a huge increase in COVID-19 activity. Norway, Finland, and Germany opened up schools with good precautions and good community precautions, and they have not had an increase in COVID-19 activity. So based on those 4 countries, which admittedly people in those countries might be more willing to follow guidelines than in our nation, it seems that there might not be an increase in activity when schools open.
All right. Let's see, next question. Should we sanitize after each use of materials? And what is the best way to sanitize, or with what?
There is a lot of information about sanitizing and closing for deep cleaning and that kind of thing. The virus does not transmit by hands. In order to get infected, it has to hit a mucous membrane, which is the inside of your nose, your eyes, or your mouth, however it's getting there, by droplet or from the most common vector, your hand. So say this pen was dropped by somebody and they are horribly sick, and this thing is just teeming with viruses. If I go like this and touch the pen, I am not going to infect myself unless I later, before I wash my hands, rub my eyes or nose. So more important than sanitizing the environment is your own hands. That's first thing. But these are schools. These are small children or not so small children. And these are well-known vectors for various infectious pathogens. So any sort of environmental cleaning would be all kinds of good and helpful.
All right, great information. All right, is it okay to use disinfectant spray on reusable cloth masks rather than wash them? And how often should we replace masks throughout the school day? How often should masks be reused and washed? So there's 3 questions now.
Okay. I would lean toward washing it rather than using disinfectant, because there is not a lot of data about prolonged inhale exposure to various disinfectants, but probably doesn't smell very good, and then you're less likely to wear a mask. At work, I wear the same mask all day long without a problem. So I don't think you need to change it after 2 hours, unless it's become soiled, wet with something where there's a physical issue with it. If you are using a cloth reusable mask, it's reasonable to wash it at the end of the day. Can you go a couple days between washings it? Sure. There is concern about I'm breathing in all these germs, but they're your own germs. So you're not introducing anything else new to you by breathing on the inside of your mask, unless you're sharing a mask with somebody, which we'll call that plan B.
All right, great. Next question. What happens when a student in your class gets COVID? If you are a co-worker, or if your coworker gets COVID, if someone in class tests positive, who all has to quarantine?
That will be at the discretion of the rules by the individual school districts. I can say the most important thing that each of us can do is just keep an eye on your own symptoms. If you have symptoms, don't go to work. If you're it's just allergies, but it's a little worse than normal. It might not be allergies. So you have to keep an eye on your own health and try not to expose other people if you are already sick.
Great information. All right, next question. How do we partner in small group with students?
If you're working in a small group, it's impossible to social distance, which is where masking takes the place of social distancing, my mistake. I am aware that some school districts are not having a mandatory masking policy. So if there are students who are not wearing masks, it might be safer for them to do more solo activities than in a small group, because they're not able to have that extra barrier of protection there. So ideally, the fewer people in a group possible, and if you are in a small group, I would think masking is very important there.
All right. Next question. How far should children's desks be spaced to be safe? Can students exercise with distance?
Spacing depends on your environment. The more you can get, the better. It depends on each individual classroom and how many kids there are. Exercising, if you're exercising, it's very difficult to do strong aerobic exercise wearing a mask. Not because it's impeding oxygen flow or anything, but even just the forceful inhales during strenuous exercise can kind of pouch the mask inside your mouth a little bit. Exercise out of doors, weather permitting, with no mask on should be okay, especially if kids are separated. If out of doors is not possible and it's a very large gym area where they can be separated, lack of masking should be okay in that area.
All right. Next question. How do I function with the threats of infection spreading in my classroom?
That's a difficult question. There is a lot of stress with this, and the education community is facing now what healthcare community faced in March, and what a lot of people in the service industry were facing in March and April. I can say you can just look at things that have happened in the last few months in service industry exposures and hospital and clinic exposures, and we've learned some, so we know better what to do now than we did back then. The best that you can do is just realize that you do what you can to protect yourself. You keep an eye out for any symptoms, and from what we know, following proper precautions, there should be fairly small risk of transmission, like mentioned in Dr. V's segment at the haircut salon.
All right. Next question. We got a few more questions. If plexiglas is used on two sides of a desk, can a student remove their mask?
I would say no, because they're not in an enclosed cubicle. So there's not real separation there.
Gotcha. All right. This next question I actually struggle with sometimes in the clinic. How to wear a mask with glasses in a way that prevents fogging?
Okay, I have two words for that. Good luck. You get used to it a little bit after a while. And also, if you have a good metal strip in the top and you pinch down here, that can help prevent it. A lot of cloth masks aren't necessarily having the metal strip in there, so try to find one that does to help it form against your nose.
All right, that's great feedback. All right, last question. What is the recommended age that children need to wear a mask? Can children share toys and play together, or do they need to keep 6 feet apart? Should we sanitize after each use of materials? And what's the best way to sanitize?
For kids' ages, basically if they're in school, kindergarten or above, they should be old enough to be able to wear a mask. There are a few health conditions that would permit that, and they would have to be able to remove the mask themselves if there were an emergency of some sort. So that's the age. As to sharing toys and sanitizing toys, really hand hygiene is more important than that. But if it's a hard surface that's communal, every so often, like in clinic countertops, we wipe them down every hour or so at least. So if it's between class periods, might be a decent time to do that.
All right, great. Well, thank you, Dr. Quimby, for answering those initial questions. Stay tuned, though, because we're going to have you back in a little bit to answer more questions as they're coming in live. So next up, you know, as we're learning about the facts about COVID-19 and infectious disease, you know, we have to also understand the side effects of this on students. Some of those things could be fears, mental health, such as depression and anxiety, social isolation and what that means to mental health. And how do we keep students academically engaged and motivated, especially with remote and online learning? So as our students are experiencing this, as adults, we need to know how to guide them and help them manage their feelings and transition them back to school safely. So next up, we have another expert with us, Dr. Monica Aurora, who is a licensed mental health child-adolescent psychiatrist with CHI Health, who will be discussing the signs of trauma from COVID-19 in children and how to support them.
Hi, my name is Dr. Monica Aurora. I'm a child and adolescent psychiatrist working at CHI. Today, we want to talk about what emotional trauma is. Emotional trauma is an experience of deeply devastating and disturbing event that is either witnessed, perceived, or experienced that overwhelms the individual's ability to cope with and shatters their sense of security and sense of control and causes a sense of hopelessness and helplessness in them. There have never been more uncertainties in kids' and adults' life in the recent past. In addition to dealing with the pandemic, we have a lot of social unrest that's going on in the community, which has been very traumatic for the whole community itself. The kids themselves who have their own personal ups and downs in their lives, when exposed to something like this, definitely takes a toll on their well-being. 5 months of restrictions, isolation, and uncertainties about their spring, their summer, their now fall, and on top of that, the outburst of social unrest in the community has been very difficult for them to handle, which is not very evident because they find a way to cope with it, but are they really coping with it in an appropriate manner? That's the question. Every kid has a unique way of handling stressors. Some kids can handle things much better than the others. And for the most part, the kids are very resilient in how they handle stress. But it comes to the point that even their mechanisms start failing them. And they are going to start experiencing a lot of things which are not very typical presentation that you would see in the kids otherwise. A typical response to trauma could be anxiety, worrying a lot, being very sad about things, losing concentration, and isolating yourself. But what is unique about kids is they usually don't present with the typical things you would think about trauma with adults. And that's where it is very important to actually pick some of these symptoms early on so that we can get them the help that they need on a timely manner. The kids are very different in how they experience things and how they express themselves. They are also developmentally different in how a younger kid presents with how they deal with trauma versus a middle school child versus an adolescent. I want to go over some of the things that I would feel that you would be noticing more in your younger kids and preschoolers or the first and second graders more so. These kids who have achieved several milestones in their life, you can definitely see some regression in the milestones. We are talking about them clinging more, having difficulty separating from their adults or primary caregivers. We're talking about regressing down to some of the milestones like bedwetting or having more accidents during the day, which they had better control over before. We're talking about maybe thumb sucking that a lot of the kids have picked up again. You will also notice some increased aggression and temper tantrums, which are difficult to console, which usually you were able to take care of it beforehand. Now, we are also talking about kids who are more somatic in nature, because it's not unusual for little kids to express their anxiety and stress through physical symptoms. So that is also something that we have to keep in mind of. Now let's move on to talk about the kids who are in between 7 and 12 or 13 year age range. They are actually more aware of what's going on in the community and the world. They may not have a complete understanding of every concept, but they're more aware of what's going around the world, and they tend to worry more about family and themselves. It is not unusual for kids at this age group actually struggle with difficulty concentration, decreased motivation, not enjoying the things that they like to do. You will also see a lot of defiance that comes out because they're just more irritable, and that is actually one of the symptoms of depression is irritability. So it is important to notice if the kids are more irritable and testing limits more than what they usually did before. You will also actually notice a lot of school refusal because of all the uncertainties we have around, not knowing how to handle certain situations still. And it is going to be a process going forward, but you will see a lot of kids refusing to go to school. They will also show some significant decline in their academic performance, just because their inability to concentrate and pay attention, and that will definitely take a toll on their academic performance. Some of the adolescents may actually resort to substance use in a way to handle their feelings and frustrations and depression, because they're trying to self-medicate themselves and not reaching out for help when they should. Now that we have a little background about what the kids could be experiencing, these kids are coming back to school now. And I just want to talk about right now how we can prepare the teachers to take care of these kids, because they are in a vulnerable position right now. And school, who has always been a very supportive environment for them, they are going to look forward to getting that support from the school. I want to have a discussion about how I believe that teachers can be, which are unremarkable resource in the school, can be helpful to make sure that these kids can actually live their daily lives and have an opportunity to learn in the school setting. There's a lot of changing in school, and there is a debate about going full-time to school versus going distant learning. Some of the school districts are doing options of distant learning, and so there's going to be a lot of challenge coming ahead for our wonderful teachers. I think I would just start with building relationships again. We are talking about all these kids who are going to be new to your class. These are the kids you may not even know from before, and now getting to know each other is always is a process. And now with some uncertainties going on in the community, it takes a little longer and a little more effort from everybody's point of view to actually build that relationship. I would start with ensuring their safety and listening to their emotions and feelings and how you can help them process that information. It is important to have age-appropriate knowledge about what's going on in the community, so you can have an open discussion with the kids, and the kids have an opportunity to ask questions that they have been hesitant to ask about in the past. Returning back to school after summer break is always challenging to get them back in the structure and the routine, and since there is a lack of academic stimulation during summer with a lot of the population, and now we're talking about over 5 or 6 months of lapse between when the kids can go back to school. So I believe it would be important to build the patience to actually reach out to every kid and see where they are at educational level so you can meet their needs. There has been a lot of educational discrepancy in regards to some kids did have distant learning last spring, some kids didn't. So we are looking at a lot of gaps in educational experiences. There could be a lot of anxieties the teachers may have themselves in regards to what they're exposed to, what they're taking home to their families. And I do believe that we all as a community, if do a good job of following precautions and wear a mask and wash hands, it is going to be okay. We'll get through it. But I want teachers who are the leaders in the school to be able to demonstrate that to the kids, because kids will follow your footsteps. Maintaining routine and structures go a long way, so it is really important to come up with a very clear understanding of how you're going to run the class, what the protocol is going to be, hand washing techniques, and that is something that I think if the teachers are able to introduce to the kids very early on, it is actually going to be something that they can practice throughout the school year. What is also going to be very challenging is to maintain your personal boundaries with parents, because at this time when we're doing a lot of digital world, ability to email a teacher and expecting a response right away does take a toll a lot. So I would highly recommend to maintain your boundaries. Reach out whenever you can, but also find a way to maintain your boundaries so you're not overwhelmed. If we all stick together, we will get through. And it's not a matter of starting with academics at this point. I think what we really need to do in the first week or first 2 weeks is build those connections, build those relationships, provide the school to be, again, a very safe place for them to talk about their feelings. And it's okay if all they wanted to talk about is what's happened in the last 5 or 6 months when they've not been in school, and their experiences, their traumas, and just being a listening ear. And sometimes that goes miles. And just if the kids can recognize that that's a safe place, they can talk about their feelings, I really think that you will be able to engage kids a little more in the academic setting when you're ready to do that. I really have a lot of respect for teachers, and I'm hoping that these upcoming few weeks, even though they're going to be challenging, we will get through. And I think the kids would need your support. My kids need my teacher's support, and I'm really hoping that we all together can make this work.
Well, hello, everybody. My name is Taylor Barth, and I'm part of the team here at CHI Health. And thank you, Dr. Aurora, for that excellent information. Well, again, thank you, everybody, for joining us. I just want to say we had over 500 questions submitted before this webinar even started, and the questions are pouring in live. Our digital team is having trouble even keeping up, so we will get to your questions. And if we don't, we are going to have another live Q&A with Dr. Quimby and Tim to really get down and answer your questions, because we know that there are a lot of those and a lot of concerns before we head into the school year. So thank you. Keep submitting those questions. And again, we'll do our best to get to them today. And if not, we'll get to them another time. Well, it's now time for our first prize drawing. So when you registered for this webinar, your name was entered into a drawing to win 5 iPads in your name that will go to your school. So our first winner today is Karen Burns at St. Pius Catholic School in Omaha. Congratulations, Karen. Again, your school will receive 5 iPads in your name. And winner number 2 is Carrie Dornbose. I'm sorry if I pronounced that wrong. Dornbose of Lux Middle School in Lincoln. Congratulations, Carrie. We will be in touch with both of you to deliver the 5 iPads to your school, hopefully by next week. So thank you so much for entering, and don't go away, because we're still going to have 2 more giveaways throughout this webinar, so you could still win. Now, first, we're going to move on to our next presentation, which is an open dialogue about how COVID has made many of us feel like we've lost control. And I know for many of you, that's probably in the classroom. And Tim is going to be leading that discussion, and I'm going to go ahead and toss it back to him. Tim?
All right. Thank you, Taylor. I appreciate it. And congratulations to those iPad winners. So next up is my old friend and colleague, Sheila St. Amant. Sheila is a licensed child adolescent mental health therapist here with CHI in our integrated school-based program. So we're going to be discussing how to support students with coping skills as we transition back to school. So hi, Sheila, welcome. Thank you for being here with us today, my old friend.
Hi, good morning. Thanks for having me.
It's like I want to hug you, but we have to practice social distancing, be good role models. All right.
Absolutely.
All right, so let's get into this. A lot of people are talking about coping skills and what that means for students in the classroom. So why don't we just jump right on in and talk about coping skills? What are some basic coping skills that you could suggest students do and teachers to encourage students to use in the classroom as they're transitioning back and are having anxiety or fears?
Right. Well, several that I can think of are Definitely utilizing the breathing skills and grounding the children to where they are. There's a variety of different YouTubes that are out there. There's a variety of different, like Go Noodle. Our school used Go Noodle a lot as far as brain breaks. Just those first few days are definitely going to be difficult in getting acclimated back to sitting down, structure, routine, all of that. So utilizing some of those coping skills throughout the day, I think would help the children to be successful in acclimating back.
Yeah, that's great. You know, even in our outpatient clinic, when I'm seeing students or patients, which is a lot of young kids and adolescents, people are asking, what do we do? And I say it's back to basics. You know, coping skills, to me, two things are very important. It's about increasing oxygen to the brain and endorphins. So, you know, staying hydrated, increasing your physical activity so you have that natural endorphin rush, if you will, and whatever that looks like that can be done safely. So absolutely. Music's a big one with kids.
Oh, absolutely.
Yeah. Getting plenty of rest. Definitely. So, all right, as we're getting questions coming in, let's jump right to it. First question: how can elementary age educators, teachers, best support students emotionally?
Okay. And again, that goes back to the structure, getting that routine down, definitely compassion, validation, variety of different things to acclimate them back. I think that teachers are very good those first few days of building a relationship with the child. And that is key, as all of us know, to providing a positive classroom atmosphere. So working on those relationships, validating feelings, having compassion for any of the fears they might be having, and recognizing those that might need additional help.
Absolutely. Building those trusted relationships in that classroom sets the tone for the whole year. All right. What are some tools that teachers can do for teenagers at the high school level, at the adolescent level, secondary level, if you will?
Well, normally I'm used to the elementary. However, I would have to say that there's many techniques that are out there. I think it's important for the teachers to find out what individually the child, adolescent, teen might be comfortable with. Mm-hmm. So maybe somebody wants that private. Maybe they want an email in the morning of just doing a check-in with each kiddo. So for teenagers specifically, right? But just finding out, maybe asking the class what they would feel comfortable with, and then maybe individualizing that to the student if they have time to do that.
All right, great. Next question. How do we help students follow new safety procedures without scarring them?
Scaring them.
Oh, sorry, scaring them. Got new bifocals.
Practice. Again, those
Mm-hmm.
first few days are just practicing. You know, some of the kiddos might need to learn how to put their masks on, might need to be reminded of the distance, might need to be reminded of the hand washing. So it's just practice, reminders, routine, and just making it, we're all doing this to keep you safe. So ensuring that they feel safe and that's why all of these procedures are in place, to keep them safe.
Absolutely. And I'd also add to that, it's very natural for adolescents or child adolescents for that matter to question things. And that's great. But so reminding to tell them the why behind that so that they understand, and that, like you said, we're all in this together. We're not singling anybody out. So, all right, next question. In a large elementary school, I am concerned with the well-being and mental health of my staff. We all want to be back to school, but school is not going to be the same place we left in March. I feel that some staff may go through a grieving process over the school that we lost. So what are some ways to support each other while we're maintaining social distancing? To me, this is classic back when we were in grad school about Elizabeth Kubler-Ross and the stages of grief loss. So maybe you could speak to a little bit about those stages and what that looks like.
Well, and it's different for everybody. And it might be different levels of where each individual's at. A lot of people have difficulties with change. As far as the different levels, you have anger, you have denial, anger,
Depression.
help me out, Tim. There we go. Depression.
Bargaining.
The final one's
like, why is this
acceptance.
happening?
Bargaining. Yes, yes, yes.
Right.
Absolutely.
And the ultimate goal is to get to acceptance, which, once we accept things, oftentimes it makes it a lot easier. But just acknowledging and validating where you are emotionally along those stages is important to understand. So, yeah. And just
supporting. Yeah.
Yeah. Just
supporting and validating. And also if they're needing additional help, ensuring that they're reaching out to get that additional support.
That's right. Connecting them with resources, because we never want to turn down a resource. All right, next question. What are some specific signs we should be looking for with students who are anxious over the COVID-19 issues? I believe Dr. Aurora kind of covered that in her segment, but maybe you could speak to a little bit about what you would see like in the school system from your experience.
Well, a variety of different things. Could be lack of sleep, anxiousness about being around others. Maybe they're isolating. Could be anger. Loss of control creates a variety of different symptoms for kids. They might be trying to control others around them, might be trying to control the classroom. So there's a variety of things that teachers can be looking for and helping them to hopefully feel safe, address those, and again, reaching out for support if needed.
Yeah. When I think about control, when I'm hearing you mention that, the strategy is to not get into control battles then as a teacher, pick and choose those opportunities and give them things they can control, like choices and using time as a variable. Hey, I need to get your assignment done. If it's remote learning, whatever the expectation is, but, using that time as a variable when that can be done, maybe might help them feel a little bit more in control in kind of an uncontrollable world right now. So next question. How can I be trauma sensitive when designing my classroom space for instruction? How do I best discuss the pandemic if I know there are students and family members that have passed away?
That's a really good question. I think we've come a long way in being able to understand that kiddos need possibly a comfort spot, a safe space, whatever you want to call it. And that'll probably have to be tailored in a little bit different way too, to ensure sanitation. But just being, go ahead.
Oh, sorry. No, go ahead. You're doing great.
Oh, no, just providing opportunities, again, for those coping skills to be utilized for that child, to know what they need to engage in, and encouraging that child to utilize that if needed.
Yeah, exactly. One thing I think of with trauma-informed classrooms is having a comfort area that students can access, when they're feeling dysregulated, and to use their skills in a safe place. But also, one of the related questions that's come up is, how do we open a dialogue? How do we encourage kids and engage them in and feeling comfortable to talk about, asking their questions, because it's important. They pick up on all of this information, whether they're hearing it at home, they're seeing it on social media, in the news. So what would be some conversation starters, if you will, that teachers could utilize with their students to encourage that dialogue?
Again, it goes back to building those relationships. In terms of the dialogue, I think each teacher has to feel comfortable discussing that and figuring out what parameters they're going to want around it. Kids have been inundated So no, we don't want to deny them the opportunity to express their fears or thoughts or whatnot, but at the same time, there should be limits, just like there should be limits to the amount of exposure they have outside of school. They're there to learn, they're there to play, gain relationships, learn skills, learn life skills, and enjoy.
Yeah, true. When I hear you talk about limits, I think of the word boundaries and helping students learn how to manage boundaries, whether it's the safe social distancing, but also it's an opportunity that's a transferable skill set that they can use on social media with the amount of information that's coming in. You know, less is more. Get that information, but then move on. We can't dwell on it, because if we do, we're going to go right down that rabbit hole, so to speak. So great response there. Next question. Emotional stress for young students. How to help students build empathy for those around them in a new learning environment. So how do we encourage students to be empathetic towards their classmates and other students?
Okay.
To me, it's being compassionate, being kind, listening, you know, not judging, some basic things. That might be look different for each age, but sometimes that could be role modeling from the teachers, doing some role plays in the classroom, maybe in a social skill activity. Yeah. All right, how about next question? How do we help adults adapt mentally with constant and sudden change? So that could be fellow teachers, that could be the teachers themselves. And we're going to be getting to some of that, you know, in our next segment. But how can we help adults adapt mentally for constant and sudden change?
The hard part about the pandemic is, yeah, everything is constantly changing. I think making sure that they are taking care of themselves, making sure they're getting enough sleep, making sure they're utilizing their coping skills, they're utilizing their coworkers, they're utilizing their EAP if needed. They can't be the best teacher they can unless they're taking care of themselves. And I think that's crucial for everybody right now. So.
Absolutely. Well, Sheila, thank you so much for being available and answering some of the questions as a local expert here with us today. We really appreciate it. It's good to see you. You know, so
yeah, you too.
So we've been talking a lot about student support, but our next segment is about teacher support and wellness, and that's something that's really important because being a teacher, you're not just instructing academics, but you're a role model and you've got a lot of responsibilities and wear multiple hats. So one of the things to keep in mind is your own self-care. There's an old adage, and which has a lot of truth to it. When the plane is in crisis and is going down and the oxygen masks drop, we naturally as caregivers want to turn to the person next to us and help them and support them. But when that plane drops, you know, we lose oxygen. So we got to really take care of ourselves first by putting our mask on first, so that we have, you know, the ability to take care of those that we care about and that we're responsible for. So I think that is a nice way to frame teacher wellness. So up next, we have Karen Williams, who's a licensed mental health therapist with CHI Health, who's going to be providing some information on teacher wellness. And then
Hi, I'm Karen Williams, and I am a mental health provider at CHI Health, and I've been doing this for about 20 years. You know, seminars like this really mean a lot to me. I think that when we go to something like this, it really helps us increase our knowledge base. And let's face it, you've had a lot of information coming at you for a long time. And today's seminar was really about COVID-19, how to incorporate some of that information as you return to the classrooms and help your students feel safe, reassured, and ready for success. But my question for you today, that piece of the puzzle that I think might be missing, is how do you make yourself feel safe, confident, reassured, and ready for success in the classroom? And that's what I'd like to talk to you about today. So part of helping your students feel comfortable is you helping you feel comfortable and confident and ready for your day. And I'd like to offer you a few suggestions today. But before I do, I want to share with you some information about why it's important to feel, well, that you're taking good care of yourself. A lot of times we're trained and raised to think that self-care is selfish and that we shouldn't be doing it. But I want to come at this from a little different angle today. I actually think it's important. In fact, I think it's probably more important now than ever before. Educators, teachers like yourselves, often have a huge list of people and projects to take care of every single day. Oftentimes, you're not even on your own list. And that's what I mean about self-care. I'd like you to at least be on the list. You might not be at the top of the list, but at least be on the list so that you can start to figure out different ways to create a self-care routine, something that will help you during times of uncertainty to create a better level of resiliency. Those who take better care of themselves actually take better care of others, and that's why we want you to put yourself on your own list. So part of good self-care involves creating a livable routine, and I really underscore livable because it has to be something that works for you. If it's not livable, if you can't do it, you won't do it. So let's start with the basics. First and foremost, getting enough sleep, 7 to 9 hours of sleep. Why is sleep important? Because it replenishes all of your chemistries in your body and your brain, and it helps you face the next day at your very best. Next thing you want to consider is eating some decent food once in a while. Now, does that mean you can't have pizza and onion rings and your favorite candy bars sometimes? Absolutely not. I don't want you to deprive yourselves of foods that you really enjoy, but moderation. Next, drink a glass of water. Stress has a way of dehydrating us, and let's face it, we are in very stressful times, so we're probably dehydrated often. Water replenishes us just like food, just like sleep, and helps us to feel better and do better. So if possible, drink plenty of water throughout the day. And of course, we want you to move. Get out of the house, dance, go for a walk, ride your bike, play basketball in the driveway with your kids, but move your body. That's good for you too. And last but not least, get some fresh air. If you're inside most of the day, poke your head outside, feel the sun on your face. If it's raining, smell the rain. Enjoy that day. Some of this stuff takes a little bit of time to incorporate. This is not about doing it all at once every single day. Remember the word livable. It's got to be something that you can do in your life, something that actually fits into your life, or you won't do it. So don't worry. You don't have to figure out everything all in one day. Just start a little bit at a time. Other things you can consider might be journaling, praying, or meditating. Those kinds of things take a little bit more time. You know, one of the other things you can think about doing is at the end of the day, when everyone's in bed, and maybe you're super tired, you're in bed too, if you could just take a notebook, maybe with a little pen, and write down 5, 6, maybe even 7 things that you are grateful for that occurred today. Maybe you felt a sense of accomplishment. Maybe it was something that you hadn't done before, you challenged yourself, and you feel really good about it. I think it's really important to have a nice little review of the day and take a look at your accomplishments and maybe even what you're grateful for. Some other ideas for you are some breathing exercises. Now, I have 2 exercises that I would like to share with you today, and we can even practice them if you would like. One breathing exercise is called 5-5-5 breathing, and quite honestly, I don't know why I call it that, except that I will show you that you breathe in for the count of 5, you hold your breath for the count of 5, and you breathe out for the count of 5. Breathe in through your nose, hold your breath, and breathe out through your mouth to the count of 5 each time, and you do it 5 times in a row. And you can practice this anywhere. I'm going to do it right now, and you're welcome to follow along with me. I'll count out loud so you get the idea, but you don't have to count out loud when you do it, okay? So you breathe in, 1, 2, 3, 4, 5. Hold, 1, 2, 3, 4, 5. Out, 1, 2, 3, 4, 5. In, 1, 2, 3, 4, 5. Hold, 1, 2, 3, 4, 5. Out, 1, 2, 3, 4, 5. Do that 5 times. And if you notice, I close my eyes when I do this. Now, if you're driving your car and you're tense and you decide to practice this, please keep your eyes open. Okay? But if you're in a meeting, you can sit there with your eyes open. If you're tense about something, what this does is it relaxes you, and this is why it relaxes you. When you hold your breath for those brief few seconds, your heart and your brain start talking differently to each other. Oftentimes when we're anxious or worried or stressed, we're in a fight or flight mode. And what happens when we hold our breath just for those few seconds, our heart and our brain start to talk differently, and it moves us into a more relaxed state of being. The problem might still be there. The meeting, the traffic jam, the difficult moment might still be there, but a relaxed brain comes up with different solutions than a chaotic brain. So that's one option to help you. The other exercise I'd like to share with you is something called rectangle breathing. Rectangle breathing is also very simple to do, and you can do this anywhere, eyes open or eyes closed. What I want you to imagine is that from hip to hip is just a triangle from hip to hip. And when you breathe in, just breathe in. But when you breathe out, imagine that that imaginary triangle is just pushing out left and right. So breathe in, and when you breathe out, imagine that triangle going to the left and to the right, and let go. Just relax those muscles. And again, you can do that 2 or 3 times or only once, eyes open or eyes closed. What's happening is some major muscle groups are relaxing, and you cannot hold physical tension when you are relaxing these muscle groups. So I know you may not have a ton of time on your hands, and so if none of these things work for you, I've got a couple of other ideas, and you can do them in the car, either on your way to work or on your way home from work, such as singing in your car. Turn on your favorite Barry Manilow or Barbra Streisand and sing your heart out. Just let her rip. Singing actually is a really great antidepressant, and it helps us to feel less anxious. You can also create a gratitude list in your head. We don't want you writing in your car, but you can create a gratitude list in your car of all the things that you're grateful for that happened that day or the day before. All of the things we've just mentioned today are ways for you to get just a little bit of control back into your day. One of the things I like to say is that this gives you a little bit of say in your day. Life was stressful before COVID-19, and it's even more stressful now. That's why it's imperative that you make sure that you are taking really good care of yourself. One of the ways that we take really good care of ourselves is by giving ourselves permission to feel our feelings, and then making a decision as to how we want to manage those feelings, giving ourselves the power, empowering ourselves to feel our feelings and then choose, decide, what do you want to do about those feelings? It's important that you know that you matter, and that taking care of yourself has probably never mattered as much as it matters right now.
Welcome back, and thank you so much, Karen. Well, it's time now for our last 2 giveaways of this webinar. We have 2 more, like I said, that will win 5 iPads for their schools. So let's get to it. Our 3rd winner today is Brittany Merkvicka from Walnut Middle School in Grand Island. Brittany Merkvicka, congratulations. And our last winner of the day is Zach Ward from Russell Middle School in Millard. So congratulations to both of you. We will be in touch with you to deliver your iPads next week. And thank you to everyone who has registered for today's webinar. We really hope that you have been able to find valuable information and feel equipped to take on school this fall. Now, before I send it back to Tim, I want to share with you some additional resources that CHI Health will make available to all schools in Nebraska and Southwest Iowa this fall. Now, this book right here, if you can see it, is called A New Norm. And it's an amazing resource to help kids identify their feelings and find the light inside of them. And in a few weeks, CHI Health will give you virtual access to our Better You magazine on chihealth.com. This is going to be a great resource for parents this fall as they kind of adjust to these new challenges that the school year will present for their kids and both them. So it will touch on social isolation, how to properly mask and educate your kids. Those are just a few of the topics. So a great tool. We hope you'll share that resource with parents and parent-teachers conferences, or send the link home with kids. So thank you again so much for joining us, and I am going to send it back to Tim for a final Q&A with Dr. Quimby. Tim?
All right. Thank you, Taylor, and congratulations to those winners. Excuse me. So we're going to bring back Dr. Quimby now, our CHI physician from Infectious Disease and Control. So welcome back, Dr. Quimby. We've been taking questions today, and we've got a lot of them. So give you a chance there to get settled in a minute, and we're gonna get started here. All right. So first question. This one has to deal with sanitizing toys between children's usage. Do we need to sanitize between each child that uses a toy?
That might be a little bit difficult. I am by no means a pediatrician or anything. However, the kids of the age group that tend to use toys are often of the kids of the age group that are not the best at following directions. And they might be sharing a toy at the same time, which makes it difficult to clean between them. So I would just say try to do the best you can. If there's a set playtime, at the end of playtime, clean everything up. I mean, a lot of this stuff is uncharted waters. We are not certain, and it's do the best you can and figure out what works. I think it's not really realistic to hover over everybody, and before Johnny hands the block to Jane, you snatch it away and wipe it down.
Sure, absolutely. You know, one thing just hearing you answer that question brings to mind, you know, accountability with that, with staff or teachers. You know, sometimes it might be helpful to have a log of, hey, this is how frequently we're sanitizing and things like that, so we know that it's being done. Could be also another suggestion. A next question that's coming: do teachers who see different classrooms of students back to back need to do anything specific to reduce the risk of transmission between groups of students?
I would say just be very good about following the rules about masking and distancing. That should be effective no matter how many people you are seeing.
All right, great. Next question. Can teachers or counselors remove masks if working behind a plexiglass shield and standing at least 6 feet away from students?
We ran into some of this in our clinics where when we had our universal masking policy, it was said that in certain environments, if you're not around other people, you do not necessarily need to wear a mask. And what we found is that people who were in said environments, it's not actually as isolated as you think it is, because people are coming in and out. If you are in like a private office by yourself where nobody else is coming ever within 6 feet of you, it might be safe, but that is more often the exception than what actually happens.
Mm-hmm. All right. Next question. Do shields take the place of masks?
Shields might be helpful for people who can't use a mask for whatever reason, but they are not actually catching and grabbing droplets. It might just be preventing you from spreading them out, but there is still air circulation, so maybe downward. It's probably better than nothing, but a mask would probably be preferred.
Great. Should we remove clothes and shoes when coming home after teaching?
You cannot even find two docs working in a hospital agree if they have to change their clothes or not when they get home from the hospital dealing with people with known infections. If standard laundry seems to be okay, it does not seem to be a problem. If you have extra concern, then maybe. But again, this goes by mucous membranes and lungs. So unless you're in the habit of like bringing your shoes up and sniffing them or rubbing your dirty clothes over your face, your risk of catching something from your shirt is probably small.
All right.
Sorry.
Got some opportunities there. All right. So next question. If droplets are emitted into the classroom, how long will they stay active? Will filtering systems remove these?
And here's more points of disagreement from what you're finding. You have some aerosol scientists in saying one thing, certain epidemiologists suggesting another. True tiny, tiny aerosol droplets can stay suspended for a very long time. Whether that carries an infectious dose of virus in general is a matter for debate. Filtration systems can help, except you need pretty heavy duty HEPA type filtration to get lots of droplets out of the air. And even in a standard operating room in the hospital, which is pretty much the best air filtration system you can get, it takes well over 10 minutes to do enough air exchanges to clean it out. So in a standard home or school, a little portable HEPA filter is probably not going to do all that much.
All right. Okay, next question. I'm a teacher, a reading specialist who works with kids every day, or excuse me, from every class throughout the day. Do you have a recommendation on whether it is better for a teacher to travel to each classroom to work with their kids, or work in a hallway or another classroom, or have the kids come to their classroom, the teacher's classroom, where they can clean between each group of students?
I would say this probably depends how many students you're working with, because if, say you're working with 25 students at a time, having all of those 25 students traipse along the hallway to get to another classroom might not be as good as one person moving along, because you have more people passing each other. If you're dealing with, say, 1 or 2 children at a time for intensive reading help, then the fewer people around, the better. But I mean, that's basically, you would have to know more about the individual circumstances.
All right, great. Next question. If you boil a mask in water, is that sufficient to clean the mask?
That would work. I would have concerns about the life of the elastic of the mask, because it's nice to have a sterile mask, but if the elastic is shot so it no longer fits your face, it is not going to do you any good. For the cloth masks, a standard laundry run seems to be okay. If you are doing anything other than that, and I've seen the whole internet things with Instapots and microwaves and what have you, I would just make sure the elastic is still functional so that it is not too droopy on your face. And if it does have a metal insert over the nose, I wouldn't put it in the microwave.
Okay, yeah, well, yeah.
Hey.
That's another safety concern. Okay, next question, sorry. When you take off your mask, what's the best way to store it?
I have been using this since March.
Is that Tupperware?
This, in fact, is it a Tupperware? I don't know what brand it is. It is a Rubbermaid. So technically not Tupperware.
Okay.
And I put my little mask in there, and it's there ready for the next go with my little ear things on the inside so that it's not touching the front of the mask. I am not getting paid to sponsor any stores or anything like that, but I can say I got a package of 7 of these devices from one major nationwide retailer for about $3.50.
Sweet. All right, next question. So as long as kids and teachers have masks on, they should be able to collaborate closely, correct? For example, in a secondary science class, there's a lot of collaboration and small group discussion or discourse.
Again, dealing with an unknown, and you find people are harping on what is felt to be best information at the time that turns out not to be correct, and then saying, well, we can't believe anything that's been said. Okay, so all caveats aside, this is just best information known at the time. Ideally, farther apart is better than close together. If close together is required, for example, you mentioned science classes like frog dissections.
Sure.
Okay,
Labs.
there's not a frog for everybody. Masking is better than not masking. So it is safer than not masking. Ideally, everybody would be 30 feet from each other. That's not feasible in a functional world. Okay. But I have, in the best environments that we have information on, are hospitals and clinics. and people working closely together in those environments, if they're following masking protocols, do not seem to spread virus very, very much at all.
Got it. All right. Next question. If a child tests positive for the virus, should all their siblings of that related to that child be quarantined as well?
You need to follow the directions of the health department at the time. They have their rules about what's quarantine is recommended, what is not. And for example, not all siblings live together. So if you have two brothers who are in different households for whatever reason, just because they're siblings does not mean that they've had exposure to each other.
Great. Next question. What happens when somebody on the football team or any other sports teams becomes positive?
That would be, again, not to punt everything off, football, not to punt everything off, but health departments. There are rules for who gets tested, that kind of information. I would say if you have known exposure to somebody who has tested positive, that you keep a close eye on yourself for any symptoms and not brush off any new symptoms as just, it's nothing.
Okay. All right, next question. If the kids clean hands first, is it okay to use laptops, tablets, or supplies that are usually shared in the classroom?
I mean, there's no reasonable classroom where you're not going to be sharing supplies. So ideally, you would want to clean hands before the community material use, and then afterward as well.
Okay, great. Next question. Can you speak a little bit to prevention protocols, such as using vitamins or supplements to help ward off the virus, such as vitamin D, zinc, vitamin C, and melatonin?
There are various bits of information out there. A lot of them are not based a lot in science or not a lot of good data. It has been mentioned that they found an association where populations who were lower in vitamin D might have had more COVID activity than populations who are not low in vitamin D. But there could be various things causing that, such as more people being tested, less healthy populations in general, that kind of issue. Vitamin D is known to play a role in the immune system. There are some studies ongoing if vitamin D supplementation would help those who are severely sick with COVID. I'm just picking that as an example out of one of the ones you listed. So the best that can probably be done is keep yourself as healthy as possible. That means good physical activity, healthy diet, make sure you're not deficient in anything. If you have something like diabetes, good blood sugar control, all of those things can probably help more than taking a zinc supplement, just a generally healthier lifestyle.
It sounds like basic fundamentals. All right, this next question, and this is something actually that I think it applies to me as well now that I'm reading it. I have a sore, scratchy throat since the beginning of March. Well, seasonal allergies, here in Nebraska, we are bombarded by that. We live with that all year round, it seems like. And whether you're in the rural areas or in the urban areas, it's seasonal allergies. How do I tell the difference between a normal scratchy throat and a COVID scratchy throat? If I were to stay home each time I had a scratchy or sore throat, I'd never be at work.
Okay. I have personal experience with this as well. I am allergic to our pet ferret. Okay. So there is often some sort of symptoms that I will have on an ongoing basis. And the best that I can say is honestly, just be honest with yourself. In the cases that we've seen for people working in hospitals or clinic who attributed their symptoms to allergies and then it ended up not being allergies, looking back, they say, well, yeah, it was actually a little bit different than my normal, but I just didn't think much of it. So if it is your true normal, that's one thing. If it's worse than your true normal, you might want to take some extra precautions there and get checked out.
How would a fever apply to that? Like if they had scratchy, because there's drainage and stuff with your allergies, and how would that apply?
Allergies never give you fever. If you have a fever, you best not be blaming allergies.
Right.
On the other hand, though, not everybody with coronavirus infection will have a fever. So lack of a fever doesn't mean you aren't actually infected.
Okay, great. All right, next question. Dr. V mentioned in the video about 6 feet distancing. Is that the same distance for children and students? Or this person said, I heard it would be 3 to 6 feet for children.
I've heard some stuff like that too. And again, I'm going to preface this with the dealing with new unknown situation. They have found that kids under the age of 10 seem to not transmit the virus as readily as kids older than the age of 10. Not quite sure why. People have come up with reasons that might or might not be true, like they're short. Okay, so if you're short, anything that you're putting forth is less likely to get in the air of people taller than you. Okay, it could be something like less lung volumes with each individual breath. So given that it's not clear, I would lean toward the 6 feet because we know that that tends to be okay. And if it means you're a little bit farther apart, you're a little bit farther apart.
Great. All right, next question. Is it safe for students to take off their masks while they're sitting at their desks?
Just like the adults, people are often not as far apart as they think they are. And unless your environment is such that every desk is 6 feet from another desk, that's probably not the best of ideas.
All right. This next question is for me. How to address those students who feel they are suffocating in their mask. We cannot send them outside unattended, mentally and physically. You know, I think from my perspective, it would be just providing that child the why behind why they're wearing their mask, number one, to help them understand why they're wearing it. And if they're starting to feel like they're suffocating, give them a break. Have them step out or step to the side of the classroom to make a quick adjustment. I don't know if that's would be applicable, but within the 6 feet distancing, there's got to be some, children oftentimes are fidgeting and, they're touching their face and things like that and trying to just, remind them of the why behind what they're doing. Would you have anything to add to that, Dr. Quimby?
Kids, not my forte. I have 2 of them and they're teenagers now, so I'm happy I'm not dealing with little ones. But if they truly need a break, I mean, kids do take breaks to use the restroom. At least
Right.
They did when I was in school. So might be time for a little brief break for them. And really, if it's feeling like they're suffocating, that's often because they're not used to it, and more exposure might help with time on that.
True. Even in clinic, I see, my primary population for treatment is child adolescent. And I would say that the kids who come in for the in-person visits are very compliant. They're wearing their masks. They oftentimes have cloth masks that are, have some type of, design or preference on them that they actually think is kind of cool. So I think you'll find that they're more compliant than you anticipate that they would be. So, all right, next question. Would using air purifiers in the classroom without windows be helpful?
Honestly, they are probably not going to do enough air exchanges with the commercially available ones to make that big a difference compared to the central air system. So it wouldn't hurt, but I wouldn't put a lot of stock in it helping.
Okay. All right, next question. UNMC has warned against opening schools as of yesterday. What is CHI Health's take on this?
Okay. First, I would like to say that I am not speaking for CHI Health. I am speaking for David Quimby. I would like to look at the data available before making recommendations such as opening schools or not opening schools. We have nations that have been able to open schools so far without increase of activity. I think it's reasonable, given the social benefits of in-person learning, to attempt opening schools as long as people are willing to look at disease activity, and if it starts to increase, have a backup plan. A blanket, this is not safe, I don't think is the way to go. We also have to keep in mind that our country is very large, and what is right in one part of our country might not be right in another part of the country. For example, along the Rio Grande River in Texas, that area is having a lot of difficulty right now. Their plans should probably be different than counties in rural South Dakota that have not seen a case yet.
Great feedback. All right, next question. Our district is requiring mask breaks during the day and have suggested to have them in the classroom. Spread them out and no talking. If you've been in an elementary school classroom, this would be difficult, and I don't feel like this is safe. Should all mask breaks be taken outside?
Ideally, mask breaks would be outside or in a very large area, perhaps larger than a classroom because of the distancing possible in a classroom, but it depends how many people are actually in the classroom. I believe Omaha School District is going to have only half of the students there anytime, so spacing might be possible. Outside, whenever you're not wearing a mask, is better than inside, but distancing as appropriate should help out.
Okay. Next question. How safe is it to teach middle school PE with 4 teachers in an elementary sized gym, classes up to 20 students, so 80 students in a gym with students not required to wear a mask? That's a detailed question. Even if a teacher has on a mask, is it safe for these students or for the teachers to teach a middle school PE with the teachers in an elementary sized gym where you have 80 students in a gym and students not required to wear masks? What is my risk? Go ahead, sorry.
Oh, no, sorry. If the gym is the standard size that I am remembering, I think it might be a little bit difficult to have 80 students in there and have them distanced appropriately. I do not know if individual schools or the districts are coming up with ideas about this, like maybe have more of the PE classes out of doors or cut back on certain PE classes to other activities. That might depend on the individual place. 80 people in a small confined place is not masked is probably not the safest of ideas. We see outbreaks occurring even with, say, 40 people in a church, where you can end up with people transmitting to each other. So 80 unmasked people in a gym might not be the best way to go, but I don't know what the circumstances are at individual schools.
Great. There's a second part of that person's question. What is my risk as a teacher? We've got 6 45-minute classes a day, up to 120 students in my class, 480 students passing through the gym with 4 teachers. What is my risk as a teacher?
You can't really put a number on something like this. It really depends on the activities going on. If your classes are outside, it would be less than if they are having 80 unmasked people in a gym. So without knowing circumstances, it's tough to put a number on that. If the plan is to have 80 people unmasked at a time in a gym, again, this is one person speaking, that plan might want to be revisited for safety reasons.
Mm-hmm. All right. Next question. How do I safely pass papers to students or collect papers from students?
Just do it. The most important thing is not touching your face. Okay,
Great.
We ran into issues. This came up months ago in the hospitals with people who were transferring between hospitals, and there were medical records that would go along with the patient. And do we need to leave the chart alone untouched for so many days before we touch it? And nothing ever really turned out from that, any evidence of transmission from patient charts or anything like that. Just wash your hands.
Okay, we have time for 2 more questions. Should we wash our masks every day after we return home from teaching?
It wouldn't hurt. If you have enough masks that you can do that, you can just put it in the laundry with the rest of your clothes.
All right. Last question. I'm teaching K through 8 music where our instruments need to be sanitized between uses. I don't want the younger kids to help sanitize, but could older kids help sanitize before the end of class? What age would be okay to help sanitize?
I'm going to get in trouble for this if I'm not already. Okay, I don't think there's a set age cutoff for anything. It depends on how well the children are doing it. For example, I have a 13-year-old at my house who can't manage to pick up socks. So that would be a problem. If you can try and see how the kids do it and watch them the first few times. If they are able to do it, then it doesn't really matter what their age is, because kids have different levels of emotional maturity that are different than their calendar age. So it's basically watch them, and if they can do it, then you can trust them going forward.
That's great. Well, thank you so much, Dr. Quimby, for joining us today and providing us some helpful information from our infectious disease expert. Whoops, excuse me, I almost fell off my chair. So thank you very much. And for more resources or information, I'd like to refer you to our website at chihealth.org. So as we're coming to the end of our webinar, I want to thank everybody for your participation. We hope that you've received some valuable information that will help you transition kids back to school during these difficult times. We want to leave you with a short message from our CEO, Dr. Cliff Robertson, followed by some words from words of inspiration from a local community leader, Josh Strotzler. Thank you so much.
Hello, I'm Dr. Cliff Robertson. I'm the CEO of CHI Health. And I just wanted to take a minute to start off by thanking you for what you do. Like doctors and nurses, teachers are incredibly important to society. And even more so now, our families, the thousands of families that make up CHI Health, recognize how important you are to their family. The fact that you teach is important, but the very fact that you're frontline workers, you're essential workers in this uncertain time is also incredibly important, and something that we at CHI Health want to acknowledge and want to thank you for taking on that responsibility. Your job isn't just a job, it is a calling. So thank you for what you do. Thank you for continuing to mold and shape the lives of our children. And on behalf of all of CHI Health, I just want to personally thank you.
Well, hey, I'm so excited to be with you today. I know this has been a full day, a day rich, packed with information, hopefully a little inspiration. Obviously, we're in a season unlike any other, but I believe that this is going to be a season that has the opportunity to create incredible change for the world that we live in. My name is Josh. I'm the CEO of Abide, a nonprofit right here in Omaha, Nebraska, that serves the North Omaha community. Our mission is to revitalize the inner city one neighborhood at a time. Over the last 31 years, we've seen incredible change happen. And as a community member, as somebody who's a part of seeing change one neighborhood at a time, one life at a time, I understand some of the challenges that you face, some of the realities that go on in our communities that lead to environments our young people are growing up in. And so I'm excited just to take a few minutes just to share with you, hopefully encourage you, add a little bit of life and inspiration to the day that you've had, because I believe that you and I are a part of leading a generation of young people who are going to be a part of changing the world as we know it forever. I'm also a father. I'm a father to 4 children. Joshua, our oldest son, is 10. Joseph is 8. Juliana is 7. And our baby girl, Jada, is a 3-nager. That's right, I said a 3-nager. She's 3, but she acts like a teenager. I've been married to my wife, Jennifer, for 13 years. And as a parent, I recognize more now than ever the role that you play in the lives of our children. So I want to say thank you. You know, we're in an unprecedented time, COVID-19. Who would have ever thought that our world would be where it's at today. Schools being shut down, sports being shut down. I played basketball at Creighton University from 2005 to 2009, and I couldn't believe when March Madness got shut down this year. But it's a reflection of the times we're living in, the pandemic that's changed everything. On the heels of the pandemic, the COVID-19 pandemic, we've had the racial tension, the videos that we've seen. I've been telling people those videos have given visuals to voices that have been crying out for generations. And many of you know what it's like. The young people you're working with are having experiences on a consistent basis where they're not having the same opportunity to reach their full potential. As leaders, as teachers, we get the opportunity to be that voice, to be a bridge. So every student, every person we're working with has every opportunity to become who they're called to be. I believe, and I know this is crazy to say, but I believe that crisis is actually a catalyst and can be a catalyst for change if we will allow the crisis to maybe change the way we've done things, to help realign us. Now, I know there's a lot of fear, there's a lot of anxiety going into this year, and I know doctors and professionals who are a lot wiser than me have been able to speak into that. And so I'm not going to focus on the medical side, but I am going to focus on what I think we can continue to do as leaders to be a part of the change, and how we can even leverage this uncertain time to bring hope. I think one of our greatest opportunities as teachers, it's not just about what we say, it's not just about the information we give, but it's about the environment, it's about the culture we create. It's about creating an environment where our students and young people can have an opportunity to succeed. And it starts with us. That's what I love about today. We can't give what we don't have. And so today is a day where we're getting filled up and we're getting energized. And it's important that on a consistent basis, we're doing things, we're learning, we're growing, we're staying energized so that we can bring that type of energy and passion and confidence to the students that we're leading. There are three things that I just want to encourage you. You're already doing it, but I want to encourage you to keep doing it because I think these things matter when it comes to leading people. Number one, presence matters. Your presence, it matters. There's a lot of things that, as teachers, we want to accomplish and we want to do. But just by virtue of you being present in a young person's life starts to give them a picture of what success can look like. Over 31 years ago, my parents, our family lived in Millard, Omaha, and my dad wanted to be a part of making a difference in the world, and so he moved our family from Millard, Omaha to North Omaha. And at the time, he didn't know it, but we moved into a neighborhood that the police would redline as one of the most violent neighborhoods in our city. And we experienced many tragedies. Our neighbors were murdered. Our house was shot at. House was broken into. Our toys were stolen. And several years after living in this neighborhood, we bought a couple of old abandoned houses and fixed them up and started to work with the neighbors. The police came to us, and they knocked on our door, and they said, "We don't know what happened, but this neighborhood that was once one of the worst is now one of the best. And we want to know what your strategy is." And to be honest with you, at the time, we hadn't formulated an official strategy, but what we began to realize was that when there is a positive presence in the midst of chaos, change actually happens. That positive presence starts to become a model of what it looks like to be a healthy family, a healthy individual. That positive presence starts to invite people to be a part of the positive activities that they're partaking in. A positive presence in a neighborhood revitalizes that community. And we've seen that in neighborhoods all over our community right here in North Omaha. Your positive presence has the power to impact and transform the life of an individual. And so I want to encourage you, change doesn't happen in one day. Change happens every single day. And every day when you show up, whether it's in person or in this season, maybe it's virtually, your face, your presence, your attitude, your demeanor Just by showing up, your presence matters. And your presence has an impact on those that are around you. Number two, I think something that matters significantly is our posture matters. How we carry ourselves. I love the saying of a former CEO and one of the founders of Southwest Airlines, Herb Keller. He said, we don't hire people who have the right skills. We hire attitudes, because we know we can always train people to have the right skills. Our attitude and our posture has an impact greater than we know. I've heard it said that success is more caught than taught. Our attitude, our demeanor, how we carry ourselves, man, people feel that energy. It can encourage them to see a picture of how they're called to live. And so I want to encourage you. We can't control everything, but we can control our attitude. We can control how we respond in this season more than ever. I know we're facing the fear. We're facing the anxiety. Imagine our young people. Imagine what they're feeling, the unknowns. They're watching us to see how to respond in times of adversity. When I was in high school, we had just lost a significant basketball game. And at the time, I mean, basketball was everything to me. And I thought it was like the biggest deal in the world. And I'll never forget my coach sitting me down, and he said, Josh, he said, the reality is it's not a matter of if adversity is going to hit your life. It's a matter of when. And how you respond to that adversity is what matters the most. And I didn't know it at the time, but I would go on to play at Creighton. In my freshman season, I would get hurt, and it would shift the direction and the course of my basketball career and kind of took away some of my dreams. But because I was able to adjust, it started to open up new opportunities. And I would move back to the community that I was from, and I went from trying to pursue being a game changer on the court to living a game-changing life. And so I want to encourage you. Number one, man, our presence, it matters. Our posture, it matters. We can control the attitude that we have. And number three, our priorities matter. Our priorities as teachers, we get to focus on things that we believe are most essential for our young people to grow and develop and become who they're called to be. And as you approach this year, as you approach a year filled with so many unknowns, I want to encourage you to think about your priorities and to think about what matters the most. Maslow's hierarchy of needs, it talks about a process to people reaching their potential and self-actualizing. It talks about how, first and foremost, individuals have to have their basic needs met. They have to have food and water and shelter. They have to have safety and stability. But then it talks about the psychological needs, the love, the care, the nurture that are required to finally allow people to take advantage of the education, of the employment opportunities that are out there. And so as leaders and as teachers, we're not just giving information, we're creating an environment where things and people and individuals can grow and develop, and our priorities need to be the children's names over just the numbers that we're focused on. We've got to value each individual, not just focus on their vocabulary. We got to focus on helping them live with a level of grit and tenacity, not just focus on their grades. I believe that this year, more than ever, it's more important that we focus on and make sure that the priorities are on the individuals that we're serving. And when we create an environment for growth to happen, can I tell you, growth happens. Environments matter. In my neighborhood, I grew up, 2 parents loved, encouraged me, took me to extracurricular activities, took me to practice. I'm a product of the environment my parents created for me. The kid who grew up across the street from me. At a young age, mom, single mom, great mom, but she was busy working and trying to provide for her family. At a young age, he got caught up in gangs And at 16, he was gunned down on the corner of our block. Same neighborhood, different environments. As teachers and leaders, we get to create environments for things to grow. And so I want to encourage you. Your presence matters. You can control that. Our posture, your posture, it matters. And we get to focus on the priorities that I believe are going to lead to change. We're in unprecedented times, no doubt about it. But I believe that as we look back 10, 20, 30 years from now, there are going to be unprecedented stories because people like you said, you know what, I'm going to leverage this crisis and I'm going to use it to catalyze my leadership. I'm going to try to do more. I'm going to try to be more, not just for the sake of doing more and being more, but for the sake of those I'm leading. We're going to hear stories as a result of the impact you're going to have on your students. And I just want to reiterate what I said earlier as a father, as a community leader, as somebody who has a passion to raise up leaders who are going to lead in generations to come. Thank you. Thank you. We know that your job is not easy. And many times those days get very long. But thank you for showing up. Thank you not for having all the answers, but for deciding to leverage the influence you have to impact the students that you lead. I'm honored to be a part of today. I hope and pray that it was an encouragement to you. And I'm ready to see all that's going to happen in years to come. Keep leading strong. We can do this together.